Hello, amazing viewers of Wally's nursing videos. Welcome back to another exciting episode where we dive deep into the intricate world of nursing and healthcare. Today, we're about to embark on a journey that will unlock the secrets behind drugs affecting inflammation and infection. Imagine this: the powerful synergy between medicine and our body's natural defenses, working hand in hand to tackle inflammation and infections head-on. Are you ready to explore this captivating realm? Let's set forth on this enlightening voyage together. In this review, we're immersing ourselves in the nitty-gritty of therapeutic agents designed to combat the challenges posed by inflammation and infections. From antibiotics that stand guard against bacterial foes to antivirals that wage war against viruses, we're delving into a world where nursing expertise meets the art of healing. So, what's on the horizon for us? Brace yourself for more than just textbook jargon. We're delving deep into the mechanisms that power these drugs. We'll unravel how they precisely target specific pathways to alleviate pain, quell inflammation, and stand as barriers against invading pathogens. But we're not stopping there. We're diving into dosing strategies, understanding how to tailor treatments to suit each patient's unique needs. We're shedding light on potential side effects that may arise, and we're uncovering contraindications that arm us with the knowledge to provide safe and effective care. Think about it: these insights aren't just dots on a chart. They're the keys that open doors to enhanced patient well-being, a cornerstone of nursing excellence. Whether you're a nursing student, a seasoned healthcare professional, or simply someone curious about the magic of medicine, you're in for a treat. Don't forget to hit that subscribe button and tap that notification bell, because we're about to venture deep into the heart of drugs affecting inflammation and infection. Join us on this insightful journey, exclusively on Wally's nursing videos. Let's dive right in. Inflammation, infection, and the use of antimicrobial agents. This section serves as an indispensable foundation for comprehending antimicrobial therapy. We embark on a voyage through antibiotics, antivirals, and antifungals, understanding how these agents intervene in the microbial world. Antibiotics like amoxicillin, ceftriaxone, and azithromycin target bacterial cell walls and protein synthesis, while antiviral agents like oseltamivir inhibit viral neuraminidase. Antifungals like fluconazole disrupt fungal cell membranes. As we delve into dosing, it's crucial to recognize amoxicillin's dosing based on severity of infection and ceftriaxone's considerations for renal function. Oseltamivir's dosing varies based on influenza type, and fluconazole's dosing depends on the fungal species involved. While antibiotic side effects range from gastrointestinal upset to allergic reactions, antivirals may lead to neuropsychiatric effects. Antifungals like fluconazole may provoke hepatotoxicity, necessitating careful monitoring. Contraindications should be respected, including penicillin allergy for amoxicillin and oseltamivir's early initiation for optimal efficacy. Drug therapy to decrease pain, fever, and inflammation. This area embraces the art of pain, fever, and inflammation management. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen inhibit cyclooxygenase, curtailing prostaglandin synthesis. Acetaminophen centrally reduces prostaglandin synthesis in the hypothalamus to lower fever. As we uncover dosing, ibuprofen's regimen is determined by the specific NSAID and patient needs. For acetaminophen, dosing is calculated based on weight and age. Adverse effects may range from gastrointestinal bleeding with NSAIDs to hepatotoxicity with acetaminophen in high doses. Contraindications include gastrointestinal ulcers for NSAIDs and liver dysfunction for acetaminophen. Drug therapy with corticosteroids. Corticosteroids, powerful anti-inflammatory agents, command center stage in this chapter. Prednisone, hydrocortisone, and dexamethasone modulate immune responses and inflammation by suppressing cytokines and immune cell function. Tailoring dosing is paramount, considering alternate day dosing to mitigate adrenal suppression risks. Potential side effects encompass immunosuppression, osteoporosis, and metabolic disturbances, along with contraindications in active infections, systemic fungal infections, and hypersensitivity to corticosteroids. Drug therapy with beta-lactam antibacterial agents. Beta-lactam antibiotics are vital in treating bacterial infections. Penicillins, amoxicillin, cephalosporins, cefazolin, and carbapenems, imipenem, target bacterial cell walls, resulting in lysis. Amoxicillin's dosing hinges on infection severity and cefazolin requires renal adjustments. Allergic reactions are common, and cefazolin necessitates caution in patients allergic to penicillins. Potential cross-reactivity should be weighed. Imipenem side effects encompass nausea and vomiting, and contraindications include allergy to beta-lactams. Drug therapy with aminoglycosides and fluoroquinolones. Managing bacterial infections entails expertise in aminoglycosides, gentamicin, and fluoroquinolones, ciprofloxacin. Gentamicin disrupts protein synthesis, necessitating dose adjustments in renal impairment. Ototoxicity and nephrotoxicity are concerns. Ciprofloxacin inhibits bacterial DNA synthesis, with dosage adaptations based on renal function. Achilles tendon rupture and phototoxicity are side effects to monitor. Specific contraindications include myasthenia gravis for gentamicin and epilepsy for ciprofloxacin. Drug therapy with tetracyclines, sulfonamides, and urinary antiseptics. This chapter encompasses tetracyclines, doxycycline, sulfonamides, trimethoprim sulfamethoxazole, and urinary antiseptics, nitrofurantoin. Doxycycline inhibits bacterial protein synthesis, demanding cautious use in patients under 8 years old due to tooth discoloration. Trimethoprim sulfamethoxazole targets folate synthesis, necessitating renal dose adjustments and folic acid supplementation. Nitrofurantoin's mechanism involves bacterial DNA damage. Gastrointestinal disturbances and skin reactions are side effects to monitor. Contraindications encompass renal dysfunction for nitrofurantoin and potential interactions with methotrexate for sulfamethoxazole. Drug therapy with macrolides and miscellaneous anti-infective agents. Macrolides, azithromycin, lincosamides, clindamycin, and miscellaneous agents take center stage. Azithromycin hinders bacterial protein synthesis, while clindamycin disrupts bacterial protein production. Macrolides dosing regimens vary, and potential hepatotoxicity must be monitored. Clindamycin necessitates caution due to its association with C. difficile infections. Contraindications include liver dysfunction for macrolides and colitis for clindamycin. Drug therapy for tuberculosis and Mycobacterium avium complex disease. Tackling tuberculosis requires a specialized approach. Isoniazid, rifampin, and ethambutol target various aspects of mycobacterial growth. Isoniazid's dosing regimen requires close adherence, while rifampin's potential hepatotoxicity demands monitoring. Ethambutol's dosing is weight-based, necessitating visual acuity assessments. Contraindications include severe hepatic impairment for rifampin and ocular disorders for ethambutol. Drug therapy for viral infections. Antiviral therapy mandates precision. Oseltamivir targets influenza neuraminidase, inhibiting viral release. Acyclovir halts viral DNA synthesis. Oseltamivir's dosing varies by influenza type and acyclovir's dosing adjusts based on renal function. Acyclovir may lead to nephrotoxicity, and oseltamivir has neuropsychiatric effects. Contraindications encompass allergies for oseltamivir and renal dysfunction for acyclovir. Drug therapy for fungal infections. Antifungal agents navigate diverse infections. Azoles, fluconazole, inhibit fungal cell membrane synthesis, with dosing determined by the fungal species. Potential hepatotoxicity and drug interactions are key considerations. Contraindications encompass hepatic dysfunction for azoles. Drug therapy for parasitic infections. Protozoa and helminths necessitate tailored treatment. Agents like metronidazole target DNA, and dosing is adjusted based on specific parasitic infections. Adverse effects encompass metallic taste and disulfiram-like reactions. Contraindications include alcohol use for metronidazole. This comprehensive review unveils the pivotal role of drugs affecting inflammation and infection in healthcare. By delving into mechanisms, dosing strategies, potential side effects, and contraindications, healthcare professionals are empowered to navigate this complex therapeutic domain with precision, ensuring patient safety, well-being, and enhanced treatment outcomes.